Thank you for taking the time to join me. My name is Ken Rosenberg. I'm an acupuncturist and herbalist at the Institute for Health and Healing. I work out of our Marin Clinic in Novato on Tuesdays and Thursdays, and I'm in Santa Rosa on Wednesdays and Fridays. And I thought it could be helpful today if I talked a little bit about cupping. Cupping is a therapy that's been coming up more and more often, getting a lot of questions from patients about it. I find it really interesting because it's this ancient technique and it's experiencing this sudden increase in popularity. Most people have seen or heard of it, but there's not a lot of understanding of how it works. So I thought it would be useful or helpful to explain some of this to you guys today. I hope you find it interesting to learn about, and perhaps you may be even inspired to try it or know of someone that can benefit from this therapy. I think by now most people have heard of this. If not through personal experience, maybe through a friend or a colleague, or you've seen it in the news. I know 4 years ago, some of the Olympic swimmers had cupping marks all over their backs and shoulders, and some even on their chest. And a lot of magazine covers were featuring the American swimmer Michael Phelps with his cupping marks. So now some of you might be thinking, oh, yeah, that thing that leaves the bruises. If you still have no idea what I'm talking about, no, don't worry. I will give a brief overview, and then I'll go into how this works and what is actually happening. I think many people don't know this part well. Not only the patients, but even some of the providers who are doing this therapy, I don't think they fully understand this. And with this increase in popularity, we're seeing all varieties of practitioners using this therapy now. Chiropractors, massage therapists, physical therapists, and even some doctors are taking advantage of the healing benefits. Even patients are buying the equipment themselves online and doing it themselves. I have a lot of patients that come in of all nationalities and they say, oh, my grandparents used to do this and they learned it from their parents. So I'm seeing a real range in people's understanding of how to best apply this and what to expect, and also considerations for self-care before and after a cupping session. Okay, so if you still don't know what I'm talking about, cupping is an ancient art which has been utilized by healers and lay people in many cultures around the world and has been handed down from generation to generation over thousands of years. Cupping is a suction technique designed to pull toxin buildup or muscle spasm from the body's deeper tissues to the surface level on the skin. Cells of the body use oxygen, give off carbon dioxide. When the energy is blocked, the cell waste or carbon dioxide gets blocked or trapped in these deeper tissues. Physical pain implies blockage in the flow of energy or body fluids through the painful area. Chinese medicine says, if there is stagnation, then there is pain. And if there is pain, then there is stagnation. When toxins or cell waste stagnate in the muscles or joints, it can be very difficult for the body to get rid of this waste, causing further blockage and discomfort. Utilizing cupping techniques, we are able to, by vacuum or suction, pull the blockage out of the deeper tissues and move it to the skin surface. Once on the surface, it's much easier for the body to eliminate toxins through the superficial blood supply or capillary system. In only 10 minutes of cupping, not only can we pull toxin buildup out of specific areas, but we can also pull the fresh new blood into those areas, which will vitalize and restore proper flow. Right? So these areas of muscle or joint pain, tightness, even muscle knots, the flow of energy and body fluids, mainly blood, is not moving efficiently or optimally. This is what we mean by stagnation. I think of this stagnant blood as deoxygenated, overloaded with carbon dioxide and cellular waste. Using suction to pull this out of these tissues to the skin level, we are creating a temporary void in these areas, which is quickly filled in by the body with fresh, red, oxygenated blood that is carrying nutrition for these areas. I think of this fresh blood as bathing these tissues in fresh nutrients and restoring flow. Another way to think of this is we're not just pulling toxins out, we're pulling fresh blood in. So in painful areas, which is to say areas of stagnation, the circulation is not optimal. The blood, the energy are not flowing freely. Cupping will pull from these muscles or areas, creating a temporary void, and the body will then bathe these muscles in this fresh red oxygenated blood to provide nutrients and healing. This old deoxygenated or stagnated blood is pulled to the skin level, where the superficial capillary system will flush it out more efficiently than the deeper tissues are able to. At the skin level, it is very easy for the body to circulate it out. Where there's areas of blockage, you'll see the skin is discolored. This can be pink, red, purple, or even black, depending on how severe the problem is. And these marks typically take 2 to 10 days to fade away, depending on how dark these spots are. So this feels like a good place. Let me point out, these spots are not actually bruises, right? A bruise occurs from broken capillaries after a contusion, an impact. You're hit by something, you take a fall, and some capillaries break, and you have a bruise, which is blood seeping out of broken capillaries. So in a way, that's kind of stagnant blood that doesn't have oxygen in it, that's leaked from the vessels and is sitting waiting to be reabsorbed. One difference is, though, the cupping marks, they look like bruises because of the color, but they're not actually bruises, and they don't need to be treated as such. So to the patient, they can't even feel they are there. A bruise would be tender to the touch. These areas, they feel like normal skin when you press on them. And I typically allow the body to just flush this through on its own time. There's no reason to expedite the process unless the patient's really worried about it, or if there's some reason such as vanity that they need to have these marks removed more quickly. And then, there's certainly tricks for doing this. Kinesio tape is a very popular technique now. A lot of chiropractors and physical therapists are using it, and sports trainers. And that can be placed over these areas, and it will create flow just below the skin. Chinese herbs can be utilized. There's a popular formula called Jingu Di Shang Wan, which translates roughly to muscle bone traumatic injury pills. The old text states this formula treats kung fu hurtings and horse falls. The modern use states basically this formula is really great for bruises and is indicated for sports injuries, strains, sprains of muscles, tendons, ligaments, contusions, things of this nature. There are also Chinese herbal plasters and liniments that could be applied topically. I typically don't bother breaking these things out for cupping marks, even though they work beautifully. They're messy, they stain clothing, and you walk around smelling like an herbal apothecary. I save those tricks for like someone comes in with a sprained ankle, and I've never failed to blow someone's mind by how much these plasters and herbal liniments will expedite their recovery. Okay, so a little tangent there, back to cupping. It's an extraordinary technique. Its effects are immediate. The healing process can be shortened by weeks or even months when cupping is used to manually remove these energy blockages, and it could do this in a way that other therapies can't. Cupping is also diagnostic as well as therapeutic, and it can tell us 3 basic things. First, cupping tells us exactly where the problem is. I usually cup an area slightly larger than the area the patient's in pain in order to ensure that the area of pain is completely covered. Some skin under the cups will color and some won't, even though the exact same amount of suction has been used with all the cups. And even under a single cup, you may see part of the area color while the rest does not. So it can tell me very specifically where the problem is. Second, cupping will tell us the kind of problem with which we are dealing, as problems relating to toxin buildup or muscle spasm will cause the skin under the cups to color, whereas issues dealing with nerve or bone will not color at all. If you see color, you can assure the patient they will immediately feel better. You don't get color without getting relief. I mean, seriously, you don't get color without getting relief. I know when I see color, that patient is going to be surprised by how much better they feel instantly. Third, cupping will tell us the severity of the problem. Light or moderate blockage will cause the skin under a cup to color pink or red. That may take, a day or two for the color to go away. But severe stagnation can cause the skin to color a deep scarlet, purple, or even black. It may take 7 to 10 days for the dark color to disperse. And all of this information is helpful not only in treating the patient, but in making an accurate diagnosis. Cups rarely need to be applied for more than 10 minutes. If no color appears in the first few minutes, I may take the cups off and just skip cupping altogether, or I might place them somewhere else on the body and look for an area where there's color change. And what can you expect in terms of how this feels? First, let me say, I don't do cupping light. While gentle cupping may feel really good, not much actually happens. I am looking to provide immediate relief to my patients. I'm looking to inform my diagnosis, and I'm looking to create lasting change. So the cupping sensation can be a little bit painful, especially for the first 60 seconds. This is the time during which most of the toxins are removed, and then it gets much easier. I always work with patients for their comfort level, and maybe I'll use less cups over more time. Some people have a high tolerance, so I'll put all the cups on at once. Let's see what else to say. Cupping can be an intense treatment, and patients need to be well rested and nourished. If a patient has low blood sugar, they might not feel well afterwards. Other factors, the environment is always factored in when cupping. Patients need to keep the areas that were cupped warm and away from wind and cold. Diagnostically speaking, in Chinese medicine, we think of a tight muscle or a muscle spasm as a cold muscle. Now, you don't have to feel one bit cold to have what we consider cold to be localized in a muscle. Chinese medicine talks about this concept, we call it Wei Qi. Wei Qi is this energy that circulates on the surface of the body to protect us from the environment, from wind, from cold, damp, from pathogens, allergens, etc. And after cupping, the surface is open in these freshly cupped areas. A Western way to think about this might be to think of the pores of the skin are open. At any rate, the area is especially vulnerable to attack for 48 hours. Exposure to wind and cold can completely undo the treatment and can bring the problem back in, perhaps even more deeply, where it can cause havoc, perhaps more profound than the original insult. I have seen symptoms of muscle tightness and muscle spasm occur when this advice is not followed. So having a fan or an air conditioner blowing on a freshly cupped area can completely undo all the work we've done. And teachers and practitioners who really understand this would even avoid using cupping on a cold or rainy or windy day. Earlier this year, I had a patient come in, and during the intake, I suggested, we might consider cupping for that. And she was very excited and rolled up her sleeve and showed me, look at my shoulder, look at the cupping marks. My doctor did this on me earlier this week, and she instructed me to go home and put ice on the bruises. Okay, not exactly how I would do it, so a different range of understanding here. And most of the time, when you cup somebody, there's an immediate decrease in pain and an increase in range of motion. Although occasionally an area can feel worse at first before it feels better. This varies per individual and how much toxin was liberated. I was taught that shoulders are prone to feeling worse. Fortunately, I've not had this happen. Maybe I've just been extra careful on shoulders because of getting this warning in my training. And I've seen really dark cupping marks on necks. And, I know the patient's going to immediately feel better, but there's a chance the next day they might be really sore, and then they're going to feel even better after that passes. So let me just pick up here. In addition to treating musculoskeletal pain, thank you for responding. I also use cupping very frequently in one other way, and that is for detox. There's some spots on the body where we believe the liver will dump the excess pollution it cannot flush out. A healthy liver and healthy kidneys will detox the body for the most part, but what does not get eliminated gets stored. Let me say that again. Whatever the body doesn't eliminate, it gets stored. And we're being bombarded these days with all kinds of toxins in the air, in our food. And so cupping these areas will liberate these stored toxins. And when I do these on patients, a lot of time people report like immediately they feel more clear mentally. I look at them after and they're like, their eyes are clearer, their skin's clearer. You can tell they feel better. But, we're liberating some stored toxins and the body's going to be flushing these out. So, you could expect to feel tired the next day, maybe even for 2 days. And this also, cupping these areas is really effective for chronic skin conditions. I cupped a woman last week on these detox points. Just, she's never done it. It seemed like a good idea. She had some skin rash down on her hip pelvis area that we didn't even talk about. But after the cupping, she came back and told me that in the detox points made that rash go away. And let's see, what else to tell you about that? So, what are we flushing out, these toxins? I'm talking about CO2 buildup, cellular waste, food additives like nitrates, sulfates, food coloring, BPA and plastics and packaging, and other chemicals that you might get from eating non-organic food, and air pollution and all that kind of stuff.